Otitis externa is a condition that occurs when bacteria enters the external auditory canal. The acute form, acute meaning rapid onset, is caused primarily by bacterial infection. Pseudomonas and Staphylococcus aureus are the most common pathogens. Otitis externa, most commonly known as swimmer's ear, is frequently caused by minor ear trauma, coupled with humidity, heat, and moisture, conditions one is commonly exposed to while swimming. The bacteria enter the area and the infection begins. Ear trauma, digital trauma, ear irrigations, and the use of small objects to clean or scratch the ear canal can all lead to otitis externa. In addition to the causes that have already been listed, keeping the ear too clean can also lead to this condition, as a small amount of earwax actually helps to keep the bacteria out of the body. Symptoms of OE include itching, canal edema or swelling, canal redness, and drainage. Targeting the causes of swimmer's ear, otitis externa, such as moisture and trauma, will help prevent reoccurrences. Techniques include using soft, malleable earplugs to block the entry to the ear canal, or removing water from the ears after swimming by positioning or shaking the head, or by using a hairdryer on a very low setting. As mentioned before, cotton swabs should be avoided because they might impact earwax. Daily treatment with alcohol or acidic drops during at-risk activities has also been suggested. Over-the-counter products, such as swimmer's ear, can be used for this purpose. Hard earplugs should be avoided because they can cause trauma. As always, consult a healthcare professional should you have questions. Next, we will discuss how to administer eardrops. To administer eardrops, first, wash your hands thoroughly with soap and water. Next, gently clean your ear with a damp face cloth. Make sure to dry the ear after cleaning. Warm the drops to near body temperature by holding the container in the palm of your hand for a few minutes. Usually 1 to 2 is enough. If the drops are a cloudy suspension, shake the bottle well for 10 seconds. Check the dropper tip to make sure that it is not chipped or cracked. Draw the medication into the dropper or hold the dropper top bottle with the dropper tip down. Place the patient in a sideline position with the affected ear facing up. You may also tilt the head so that the affected ear is facing up. Be aware that the individual receiving the medication will need to remain in a stationary position for at least 2 minutes. Pull the ear back and upward, or if giving to a child younger than 3 years of age, backward and downward to open the ear canal. The drop should be instilled in the ear canal by holding the dropper at least 1/2 inch above the ear. Follow your doctor or pharmacist recommendation for number of drops that should be placed in the ear. After the drops are placed in the ear, maintain the position for 2 to 3 minutes. Gently rub the skin in front of the ear to help the drug flow inside the ear. For an alternative method, insert a soft cotton ball into your ear to avoid medicine leakage. Perform whichever method has been recommended by your pharmacist or doctor. Lastly, be sure to replace and tighten the cap or dropper right away to prevent contamination. Wash your hands to remove any medication that may have spilled on them.